Hey guys, Don here. Welcome to the $1 Million Minute. We're going to go over kind of what happened on this Monday. I'm recording it actually on a Tuesday. It was a crazy day. So we've been doing our training. We had 3.5 hours on Monday for our ModMed transition. So we've been with Athena for a number of years, and everyone kind of asked me why we're switching. Well, this is our fourth EMR. So I started with MediNotes. And then from that, because it wasn't really totally certified, we went to Litech MD, which was a cheaper version, but it was kind of a in-office version. There was no web browser. Then we went to Athena, which we really liked it. The problem is it just got real expensive. So for 4 doctors, basically our thoughts are with ModMed, we should be able to save about $70,000 per year. So it's a really big chunk, and that's kind of why we're doing that. And so we're doing the training. It seems like a lot of clicking and tapping. We are very good at typing, so we are all fast typers. And so they're kind of recommending for a lot that aren't doing the iPad, but we're going to try to do it with desktops. I think we're going to have our staff do iPads for the consents for procedures and taking pictures of the wounds and things like that we want to do. But it's kind of overwhelming. I'm recording this after the second day. I can kind of see some similarities. We're still kind of working on the difference with the documentation. So it's going to be a little bit of a challenge because I have to learn it and then I have to teach my scribe it, or we're going to kind of learn it together. So if anyone has any great tips, let me know. But as I'm going along, I'm going to be just kind of sharing our experience, sharing kind of what we're learning with it. I'd love to hear if anyone send me an email what you like the best, or if you have any of your templates, let me know. I'm going to try to transition some of my templates over, but it's set up a little bit differently. So, but recording here, I had 13 patients because we had most of the morning blocked off for training. The first one was a heel fissure. So we treated the heel fissure. There was just an office visit. I recommended some things on Amazon. I have on my heel fissure treatment protocol, which is on my website. There is a link to Amazon where it has the heel socks, but she specifically needed something to offload the heel because it was hurting. It's almost like a pressure sore in the heel. So Amazon there. And actually another thing, as we're talking about ModMed, with Athena, I use something called Patient Education Genius to send out my own patient education information. So I'm still kind of figuring out what I'm going to need to do in my office now for patient education, because they have kind of generic stuff there. So I'm not really sure, because I don't want to print everything. So I'm thinking about actually making maybe a tab on our regular website so I can send patients there for patient education, like doctor-specific information. And some of the doctors, they want it to kind of be password protected, I guess, because they're concerned about sharing everything and people getting everything for free. I'm a big believer in sharing. I don't think patients, if they look at that stuff, they're going to want to come and see us. Hopefully they're not just going to steal our stuff. But so that was the first patient. Second patient was number 4 out of 6 for Shockwave. He's starting to get better. Next patient was a patient that had foot pain just for an annual foot exam, so level 3 office visit. That was the morning. Afternoon was a patient that was an AniFix follow-up. They had 2 on the left and then 1 on the right. They are feeling much better. Just did an office visit. Didn't need another AniFix for that patient. Next patient was a 52-year-old that had IPK, so we did lesion destruction, so possible wart. Next was another AniFix. So this one here didn't really get better. So what we did is they had an AniFix on the left and on the right. The right one was looking good, but the left one wasn't because it was detached. And I think I put the AniFix on too late. So the nail was totally grown out. About 3/4 of it was onycholytic or detached, and it wasn't reattaching. So what I did is I avulsed, or took off that left hallux, and then in 3 months I'm going to see them back, and I'm going to put on the AniFix again to hopefully get it to reattach to the nail bed. I don't really have any other great ways of getting nails to reattach to the nail bed when they're onycholytic. I tried trimming it back, didn't work. I tried the AniFix without trimming it or taking it off, but so this time I just avulsed it. He had a similar situation on the right side, and it worked well. So we're going to try it on the left side. He already took Lamisil to clear up any nail fungus that was there. Next patient was a patient with kind of some chronic foot pain, and I'm going to order an MRI. Next was an EPAT number 3 out of 6 for plantar heel pain. Next was a number 2 out of 6 for Achilles pain, and the next one was a number 3 out of 6. This was very painful, hers, and I think I was hardly able to get up very high with the focused or the radial shockwave. Then the next one was a Qutenza number 2. She noticed a great improvement from Qutenza number 1 for 1 month, and then it came back. So that's what we tend to see. That's what I'm seeing now, is the Qutenza is tending to get better, and then kind of coming back, the pain with the neuropathy. Next was a lesion destruction for a little girl. She did Cantharidin. This is the 3rd session, and she's much better. So I did Cantharidin the last time, and I'm not going to see her back. And then next was a Cariflex that I applied. So once again, all my Cariflex are going to now be going to my nail technician. And for warts, when I see kids, I know some people say do Swift on everyone, and I think there's a case for that. But I just find that kids, if they've never been treated for warts, they respond so well to the Cantharidin. So I'm not a total on everyone needs Swift. Every single nail care patient needs Swift, but I think it's something that can benefit some people. Okay, so a couple of other things about like ModMed versus Athena. Like Athena has a good way to send patient education information, or it documents it anyway, because it integrates with Patient Education Genius, so I'm going to miss that. But like ModMed, I like it, the billing component, because I think I wasn't really detailed enough with Athena with the billing, so I think the billing is a lot better. That integration into it kind of makes you do things. And the neat thing is it has a lot of templates for Shockwave already in there, templates for wound care, which are much better than my current templates that I built. So it kind of seems podiatry specific, so there's some other kind of benefits to ModMed. Okay, so once again, if you guys want to send me any of your tips on ModMed, I'd be happy to share them with other people. I'm going to be trying to make these protocols to make things a little bit easier, and we'll kind of go through them from there. If once again, if anyone wants to come visit my office, I'd like to see how we can kind of collaborate. I'd love to have you come visit, or if you just want to set up time to talk to help you with your practice to get to the $1 million mark and beyond, let me know. Reach out to me down at podiatry-practice-mastery.com. Okay, have a great one.